General Hospital, who will be sharing with stoma leakage and its management, followed by Mr. Sean Quack, who is a previous osteomate. Right, he will be sharing on his journey of a stoma patient. Right. After both sharing sessions, we will have a panel discussion where we will be you can be asking questions and our speakers will be answering. And last but not least, we'll have a short quiz with prizes, which you all can answer and will win prizes. Right, shall we invite the president of OAS Singapore, Mr. Ilil, for a short speech, for opening speech, I mean.
Great. Thanks, Warren, for that introduction. It's not really a speech as such, so I don't want to bore everyone early Saturday morning with a long drawn speech about anything. But really thanks to Coloplast for this initiative under our patient and healthcare worker education series. It's actually extremely important that we give patients this information so they can manage the care of their stoma better. And this will lead to, of course, a better quality of life. And yeah, we can all go around doing the things that we normally do without having to worry too much about leakage and stuff, right? So welcome everybody again this wonderful Saturday morning. Thank you so much for spending your 2 hours with us. We hope you will have really fruitful session with us and you're able to learn things. And please feel free to share your comments in the chat box or in the Q&A box. And yeah, so that's about it. Later on, we may share something about what OAS does, but today's show is really for all of you who have logged in, all our members at Coloplast Times of Course. Have an enjoyable session. I will now hand over the time to Alex to give his speech. Alex, please.
Okay, I'll go ahead and start my section. I'd like to thank everyone for joining the session here, and I would like to thank OAS and all of our speakers for joining and making this happen. We're happy to do this, a couple of times a year, to be able to reach out to all of our customers and current or previous ostomates or those that are caregivers, to try and provide a little bit of education to help out with the management of a stoma and the life that you have before and after a stoma. We'll show a quick video here and then I'll come back and close up, and then we will get into our speakers.
I'm 11 years old and my mum's Katrina and she has an ostomy.
I remember why I had my surgery in the first place, and that was so that I could be a better mum for my kids, so I could be a more available mum for my kids.
Since she had the ostomy, she has been way more energetic, more adventurous and fun.
I was really worried about hugging people, but it took my daughter coming over me a massive hug and going, oh, that's okay, that doesn't hurt, okay, that doesn't crinkle.
I love that me and my mum can actually go shopping now for makeup and clothes and hair bows and everything.
Having the ostomy surgery gave me the opportunity to be able to do more of that with my kids.
Like everybody coming out of a surgery, you're really tender, and you don't even walk too well. But as each day went on, and you just try something, and you suddenly realize, well, gee, that nothing changed there. What else can I do? And at one point, it was got to be, okay, can I lift some weight?
There's a healing period after the surgery for 1 to 2 months, but after that, you know, you can get back to physical activity, you can get back to bike riding, running, you can get back to surfing. My wife and I, we enjoy getting on the tandem bicycle and riding that up and down the beach area just to get some fresh air in the sun. It's just a great way to get out and enjoy the outdoors. It's just always fun to cruise around on the bikes.
Working on horses that I knew were very gentle and wouldn't be pulling on me a lot. And then suddenly it was like, this isn't a big deal. It wasn't so much worried about what will my ostomy do. You know, I took it slowly, but it didn't take long.
When I want to be active, when I want to go surf, this thing is not in my mind. It doesn't hold me back from doing whatever I do. I shape surfboards. I've been shaping the boards on and off for about 10 years. It's very satisfying to build a board from scratch and then surfing on it, and it surfs so good, it surfs so well.
Going back to that active lifestyle and working on horses, naturally, I'm doing something I like. So I'm around animals that I like, I'm around people that I like, so you just feel better.
We love to get dressed up, we love to have a sing and have fun and just be together doing that.
I love that she can do my hair, that it looks really wavy, straighten, anything.
I feel so blessed that I'm able to spend those times now with my kids.
If physical activity, exercise was part of your normal life, then it should still be part of your normal life after the surgery. Keep doing it, make those things your goals, and you can do it.
So I think, you know, the video that we just showed, I really like it because, you know, it really talks about, you know, getting back to an active lifestyle. So if you were doing something before your stoma, you know, as they said, you know, you take it slow a little bit, but you know, the goal for us as a company, and I think for the clinicians as well, is that you get back to, you know, doing the things that you used to do. And not, you know, necessarily letting a stoma limit your life. I think, you know, when I compare a little bit to how things are, the stigma of a stoma in Asia versus, you know, Europe and the US, it is a little bit still limiting. And that's kind of a little bit of the theme, not only for maybe today, but also maybe for the year, is, you know, really promoting an active lifestyle. So that is, you know, why we have Sean here to talk a little bit about, you know, his journey and you know, what he has been able to do basically afterwards, because our goal at Coloplast is to, you know, let you thrive after your stoma, while you have it, as well as you know, after reversal and things like that. However, you know, it has been a tough year, the last year, and you know, that doesn't make it easy for a lot of people. So we do have a care program. So if there are things that you need, I know a lot of you are familiar with our care advisor, Iris, as well as Alice on the order taking and customer service. So if you know, if you are struggling, you know, reach out to people in OAS, reach out to your clinician, reach out to us, and let's see what we can do to try to improve your life to get back to where it should be. So with that, I will pass it on to Iris to talk a bit, and then introduce our speakers.
Hi, good morning all. My name is Iris. I'm the stoma nurse. I'm working for Coloplast. Okay, so thank you, Iliu and Alex, for the wonderful speech and introduction. So now I would like to introduce JJ. JJ is a stoma nurse working for Ng Teng Fong. So it's a pleasure to invite him to have him today with us to do his sharing on the topic of stoma leakage and its management. Okay, so without further delay, let's welcome JJ to share on the topic of leakage.
Hi, good morning all. Thanks, Iris. Let me share the screen first. All right, thank you, OAS and Coloplast for the invitation to speak on stoma leakages and its management. So my name is JJ. I'm a wound and stoma care specialist in working in Ng Teng Fong General Hospital. So my title today is, oops, I'm leaking again. So basically, I just want to teach you more about how to deal with stoma appliance leakage with ease, okay? But before that, I would like to give you a bit of a background about myself, okay? Yeah, so I graduated in 2015 in NUS before I got my graduate diploma in wound ostomy and continence practice at Curtin. And I'm also proud to say that I've also authored a book called Transition from Student Nurse to Registered Nurse. And currently, you can see on the photo there, I'm a proud member of a two-man team in Ng Teng Fong General Hospital. So, next page. Okay, so this is the place where I worked at. It's part of NUHS. My main job scope is in the Tower B, which has 700 beds. And connecting it is Jurong Community Hospital at Tower C, 400 beds. And we also have a specialist outpatient clinic. So as you can see that we are all very close by to is at Jurong East MRT station, and near neighboring it a lot of the shopping centers. Okay. Yeah, so a little bit more about what I do on a typical day. Manage complex wounds and stoma. I also counsel patients before and after stoma creation. Collaborate with the doctors, more than just physiotherapists, but also occupational therapists, medical social workers, to see how we can help all these patients back to their day-to-day life. And on top of that, we also educate doctors and nurses on wound and stoma care. Okay, so now coming back to the topic today, before we move on to talk more about stoma leakages itself, I just want to introduce to you ostomy and stoma definition. Basically, both of these terms can be used interchangeably. The main difference is that the ostomy is the surgical procedure itself, whereas stoma is a broad term, which means the opening. So in general, we have the three types of stoma here: the colostomy, the ileostomy, and the urostomy. So these are all bodily diversion. So some of these patients may have cancer, so they have to have that part of the colon removed and diverted temporarily or permanently out to the abdomen so that the area can heal. So the colostomy here is the part of the large intestine. Okay, so the large intestine, so from the mouth down to the stomach, large intestine, then small intestine, then the large intestine, then you can see that the opening there on the left hand side. The second one that we want to introduce is the ileostomy, which is part of the ileum, which is the last part of the small intestine. So the output tends to be a little bit more watery because it doesn't go through the large intestine for the absorption of water. And we also have urostomy here for patients which possibly have bladder cancers or other conditions. So they have their whole entire bladder removed, and a small part of the small intestine is taken and used as a diversion out. So this has the urostomy has no link, as in it doesn't link together with your your digestive system, but part of it is taken out to divert urine instead. Okay, so your ostomies have also various types of openings. So this is important because we need to know how many openings that your stoma has, because that will affect the way we put the pouch or the plate on top of the stoma. So I'll show you some pictures here. So for colostomy, ileostomy, and urostomy, there is this common type called the N colostomy, ileostomy, urostomy. So this is one opening. So basically, that opening, the proximal side is taken out to the abdomen, and the surgeon actually pulls it down, and you're forming a opening like this, very well budded, nice here. So sometimes in urostomy, you can see that there are two stands here and there, which don't go and pull them out because this is connected to your ureters, very close to your kidneys. This one will be removed by either the urologist or the stoma nurse itself. Okay. Okay, then we have, so this is the important thing here because I have patients. So for loop and double barrel stomas, I have patients here. If you can see in the bottom right-hand corner, there is a patient with this kind of hidden stoma. So they have 2 lumens, but unfortunately, one of the opening is a little bit more sunken in. So the one part of the stoma actually covers the other. And when we do the plate itself, sometimes we might be tempted to cover some of these red portions without knowing what it is. So this is not just for patients, this is also for nurses to take note as well when we do the pouching, because when we cover such opening, even though if it's not the opening that is actively producing the discharge, the stoma itself there is still healthy. It can produce mucus, and when it sits underneath your appliance, it can still cause some form of leakage. So this is something for us to bear in mind. Okay, so just to give you a little bit more about the burden of the ostomies itself, from February to December last year, we have about a total of 105 patients in Ng Teng Fong General Hospital, and the number of colostomy, ileostomy, and urostomies being created is somewhat reflective in the whole nation and worldwide as well. So colostomies are usually the most common ones. We have about 70, and ileostomies we have 20. Urostomies are not so common. We have 3 of them, and urostomies usually are also part of the permanent stomas because we just cannot reverse or create a new bladder on its own. So out of the 5 permanent stomas, 3 of them are urostomies, and 2 of them are because they are the whole anal portion. The anus portion is removed, so that it becomes a permanent one as well. Okay, so now at this point, I just want to do a quick poll. Okay, don't have to worry. Just make a guess which type of stoma is most likely to leak. Okay, I'll give you a few, about a minute or so to make a guess. Then later on, we will review the answers after that. Okay, so use a little bit of your imagination. So the ileostomy is remember what we talked about just now, it's the small intestine. So the fluids is a little bit more watery. Colostomy, most of the contents has been digested, so it's a little bit more harder. And urostomy is urine. Okay. All right. Ilio, the answers are coming in. All right.
Yes, I've got about 65% already answered. I'll end the poll in a few seconds, then you can carry on. I'll show you the results later. Yeah.
All right. Okay, after this, we will talk a little bit more about a healthy looking stoma. Okay, so the poll has ended. And before we talk about the how things actually leak, we want to know what is healthy, what is normal, so that we can approach the not so normal parts. Okay, so if your stoma and your peristoma skin it's healthy, it should look like the ones here, very pinkish red, moist, well budded, not sunken in, not flat, not too swollen, and your skin around, most importantly, is clean, intact, there's not red, and also very importantly that there's no skin creases. Okay, later on we'll talk more about why this skin crease can cause leakage. All right, so one of the most common issue with stomach care is leakage, and this leakage is often associated with embarrassment, stress, and poor quality of life. And why is that so? Because when we leak, right, some of these contents they are irritants. These fecal contents, right? It can burn, it can bite the skin. So and then our skin has a lot of nerve endings, so it can produce this kind of sensation. And especially if the skin is being breached or broken, right? It can be very raw, and when you touch it, it can be very painful. Sometimes you get fungal infection as well, so it will itch, produce some kind of intense itch, and you really feel like pulling out the plates away. And can you imagine if such leakage happen in the public areas, or especially when you're meeting people? Stress and embarrassment will definitely accompany with it, and sometimes because of the smell as well. And often more often than not, this will also cause you to fear going out. And for some patients, maybe they are engineers or what, they love to solve problems. But if this is a problem that they can't solve, you know, in the long run, we feel like we need to rely on other people, and soon we'll lose all the confidence. Like we'll feel that having a stoma is a very serious condition, that we cannot go out of the house, is something that is very much associated with the sick, being sick, very ill. But that is not true. Okay, so we need to we'll address that in a moment's time. Okay, so the most common causes of these pouching failure, there are 4 very common issues, and after that I'll teach you 3 steps to really rectify all these problems. These problems causes will be embedded in the assessment as well. So number 1, the number 1 cause will be the retracted and low profile stomas. Later, I'll have some pictures to show you what does it mean. Basically, these discharges will sit underneath these gaps, underneath the wafer, because the stoma is not well spouted. Okay, and sometimes we have like uneven surfaces of the skin. We'll also show you some of these body profiles, and around our skin, sometimes we might have lesions like broken skin or some kind of infection, and that will cause the wafers not to be able to stick well. And of course, the last one that's highlighted in red is because this is due to human cause, like we overwash the appliance. Later, I will also go through more in detail how that happens. Okay. So 3 methods just now that I wanted to tell you guys to how do we approach a pouching failure. First we look at the stoma profile, then we look at the body profile, and we assess the skin condition as well. So number 1, when we look at the stoma profile, we can see that there are various types here. On the top left-hand corner, you can see the retracted one. Then you can have the stoma that is flush with the skin. Low profile and protruding are the ones that we prefer, because it acts like a fountain, you know, it comes out and it goes to your plate. And we have the prolapsed one. Okay, for retracted and low profile stoma, we will often need these convex base plate. Here on the bottom right-hand corner is the plate with the protrusion there. Okay, so what this does is that if you have a low profile stoma or flush stoma or even retracted one, it can push down the skin and then cause the lumen of the stoma to be spouted upwards. So when the discharges comes out, it does not go sideways, but instead it will go to the plate and then go into the bag. And often accompanying the convex base plate is also the stoma belt, so that we push in the plate further and spout the stoma even more. But of course, if your stoma is already well spouted, you can do without the convex one. You just use a flat base plate. Okay, and if your stoma happens to prolapse, then you have, because when your stomach prolapse, very often it will affect the opening as well. So all you have to do is just to adjust the size of it, because sometimes if it's a bit larger, it can actually push out your plate also. Okay, so after you assess the stoma profile, you also look at the body profile. So some of these pictures here, these are my patients. Okay, they have very, very severe skin crease and dips. You can see that there's like channels for the fluids to go through, and usually you will see these portions being redder than the others, because these are the parts that the fluids will seep through, and you will require things like your hydrocolloid paste or your strip paste, which is like, I always tell my patients that this is like a cement, or in simpler terms, like a toothpaste, you know. So just to fill up these gaps, so before you put the plate itself, so then we block that channel from leaking. Okay, and you will also notice that your abdomen is like wearing clothes like that. It doesn't come in a one size fit all. Some of our abdomens are a little bit rounder than others. Some are a little bit more concave. So we can't use like a standard fits all kind of base plate. So we have 1 piece and versus 2 piece. Sometimes the reason why we more than because we can't take out the most of our patients would prefer two-piece base plate because they want to like take out the bag sometimes to wash them and put them back. But unfortunately, some of these patients can't use that because we need the flexibility. You can see from the picture also, one-piece appliance tend to be a bit more flexible, softer, whereas if you have a two-piece one, it's a little bit more rigid. So if your abdomen is a bit very round, or if it's concave in, you will probably need something that offers you a little bit more flexibility. Okay, and we also have some kind of skin conditions around the stoma that will affect the adherence of the wafers. So the first one that is most common is the contact irritant dermatitis. As the name suggests, it's due to irritants. Irritants from what? From the fecal content or even the urine that irritates the skin around the stoma. So when over a prolonged period of time, if we do not address the leakage, your skin will start to break down. And when it starts to break down, it becomes very inflamed. And when it's inflamed, it also produces fluids. So when you put the plate there, it probably can't last for long, and your plate will tend to loosen up and dislodge. So this is where later on we'll teach you how to do a little bit more of a good skin preparation and good moisture control to attain that kind of seal that you need. Sometimes my patients, they pull the plates too hard, you get skin tear around. So you can see that the skin tear is not directly around the stoma, but it's a little bit further away. It's probably because of the skin stripping. Yeah, and because of the high moisture content, you get some kind of rashes also on the bottom right-hand corner. Very itchy, and sometimes the skin can also be broken as well. And when it's broken, you can't stick it. Okay, so how to approach fungal rash? Typically, you need the antifungal cream, but the cream can be quite oily as well. So the first step would usually be to rub and massage the cream onto the rashes. Let it sit on it for a while before you actually clean the excess away. Then you do a skin preparation. So how do we do a good skin preparation? Number one, we need to do a good skin hygiene. Okay, skin hygiene. If you realize that sometimes when we poop, right, when we try to clean our butthole, it's the same. You can't just wipe once and then you expect the area to be clean. Because the contaminants tend to be a little bit more adherent and sticky. So then to approach a good skin preparation, I recommend that we use a no rinse wash, which contains things like surfactant inside, which removes the contaminants easily, so that instead of rubbing it excessively, you just need to dab dry or just gently clean it away, so that your skin does not contain any more irritants there. So you can be assured that your skin can heal. And then if your skin has some broken condition like the one that I showed you earlier on, the contact irritant dermatitis here, very mild condition, you can spray a thin layer of hydrocolloid powder, like your Brava powder or your stomachicid powder there, and then remove the excess. So this is part of the crusting method. After you remove the excess, then you use the barrier spray to lock it in. I usually don't recommend my patients to do more than 1 or 2 layers, because the more layers you put, the tendency of the plate to come off is a lot higher, because we may not be very thorough about it. Okay, so that is for simple cases, but we do have very complex ones. There's a combination of many of the issues that we have discussed earlier, like retracted stoma, deep skin crease, uneven surface, and skin damage. So you can see from the number 1 picture here, this lady actually has a peristoma hernia here. So when she coughs, the 2 area actually bulges out like a mountain. And this is extremely challenging for us to manage, because the plate just won't stick. Yeah, and number 2, you can see that we have a patient who has a stoma that is well hidden in between, because this patient used to be a little bit more plump. After the surgery, he lost a lot of weight, and the stoma is just hidden inside 2 of his the skin folds. And you can see from the lateral side, if I can draw, let me see. Okay, never mind. On the second picture here, you can see on the at the side of the stoma, there is like a channel there, very obvious. This is where the leakage always happens. And how we go about doing this, we really created a very deep convexity. So using a combination of a convex base plate, stoma rings, and the belts also. So then we also fill up the skin crease. So it's very difficult for patients to be able to manage themselves. So number 3 here, we have like a very huge, so the method for number 3, the crusting method won't work for number 3 because the area there is a lot larger and the fluids that's going to come out is a lot more. So that's when you might need to put some kind of dressing on top of these broken areas and put the skin barrier before you put the plate itself. So for these complex cases, always remember that help is always within reach, okay? So you can always approach your stomach care nurses or your care advisors, and we will direct you to the right channels or the right kind of products to use, okay? And I have patients that tell me, hey, I didn't leak, you know, but it comes in with such a huge red and angry stoma, peristoma skin. And I thought that this condition usually, you know, I won't get to see it real life, like it's more textbook based, but lo and behold, I actually saw one of such patients that is a very well-defined redness that follows the shape of the stoma appliance. So this is what we call allergic contact dermatitis. So of course, we can do the allergen test by so that we can avoid future allergen related dermatitis. But more often than not, we just switch the appliance because all these appliances, right, they contain various different materials. So the immediate action to do will be to switch to another product. And of course, we have to address the red and angry skin. We put some corticosteroids around the skin, massage it like how we do the for the fungal infection. Massage it and then let it sink into the skin. And then before we wipe it off and put the coating. And of course, if your skin is damaged, then you have to do a very good moisture control before you put your plate. So now, yeah, let's take a look at our poll. The results of the poll, then I will review the answer to you. Yay! So, okay, most of us, 68% chose ileostomy, 4% chose colostomy, and about 40% chose urostomy. So urostomy and ileostomies are very close, right? Yeah, so the answer here is ileostomy, okay? Okay, so I think like what we have discussed earlier is that you know, if there's like channels of fluid, if your skin has channels of fluid to go through, so most of us might think that, oh, okay, because urostomy is urine, right, and these are very watery content, it will probably be the most easy to sit through. Yes, that's true, but ileostomy, because it's content from the digestive system, it has also have a higher pH, which is more alkaline in nature, which kind of corrodes the skin. Our skin have this thing called acid mantle, acidic barrier, so that it protects us from external bacteria. But if we have a more alkaline discharge, it tends to corrode that layer away. So on top of the moisture itself sometimes don't destroy the skin so well. But on top of the moisture, we have the pH. And on top of that, one more thing that makes ileostomy more damaging to the skin and more prone to leakage is also because of the bacteria, simply because of the bacteria found in the gut, which is more corrosive to the skin. So in a combination of these three things, ileostomy is the most likely to leak, followed by urostomy, then colostomy. Colostomy usually because the stools are more formed. But however, if you have bouts of like loose stools or like diarrhea-like discharge, it can also potentially leak like your ileostomy. All right. Okay. So coming back to the condition, because the conditions that we described earlier were more of because of the body profile, the nature of the stoma itself. But I have a group of patients which tend to be more, I call them overzealous in washing the stoma pouch itself, because they don't like, I mean, it's natural that we don't like to see like fecal content on the back itself, because it doesn't look the nicest, and sometimes when you have too much, it can be a little bit more odorous. So it's understandable that that they want to wash it, but sometimes we overwash, and you can see that there is a little like small little nodules there on the picture there. These are what we call granulomas. Granulomas itself, it's not like very harmful, but when it bleeds, it can cause a lot of problems. And the granulomas itself is also, it can be painful. So with the plate on top, so a lot of times we have, I will notice that, how come there is these small little dots that starts to happen. And then when I ask them whether they ask these osteomates whether they wash the stoma appliance too much, and the answer is usually they wash it every time the discharge comes out. And that's why such things happen. So you can wash, but you don't wash it all the way to the stoma. So patients have to be taught on to how to empty the stoma better. But of course, we have to, there is also better choices, like the use of opaque pouches and opaque pouch covers. Can see all these osteomates here, they're smiling and they're looking very confident here. Sometimes I always say out of sight, out of mind. Okay, so if you don't see the fecal content itself, you probably will not be compelled to be obsessed to wash it. But of course, if you have the issue with smell, there is like you have to choose pouches with filters. And of course, sometimes if it with some diet modification, the smell can be controlled. And we can also throw in some kind of odor managers inside in the pouches, so that there will be no not so much a profound smell. Okay, so in conclusion, I just want to tell everyone here that even if you have a stoma, you can live confidently. Remember that help and solution is within reach. Okay, always you can approach your stoma nurse or your care advisors for help. We will definitely help you solve your problem. Okay. Thank you very much.
Okay, thank you, JJ, for the wonderful sharing. I believe we all have learned a lot from him and gained a lot of knowledge. Okay, so now our next speaker is Sean. I'd like to introduce Sean. Sean is an ex-ostomate, so he'll be sharing with you on the journey of being a stoma patient. It's a pleasure to have Sean to do the sharing for us. Okay, let's welcome Sean. Sean.
Hello everyone. Hi, my name is Sean. Okay, so let me do some sharing. Okay, wait, let me do my sharing of my sorry, how do I share my pictures?
So do you want us to help you to do the sharing?
Yeah. Okay, maybe you can help me to do the sharing. Yeah, the first, yeah.
Wait a while. Okay.
Okay, maybe meanwhile, I'll just have a quick intro about myself. I'm a personal trainer. So actually, I live a very healthy lifestyle. I eat healthy, I train. I was actually in the peak of my I would say peak of my fitness. Okay, and in 2016. Okay, so I train, I eat healthy, and then but suddenly something just hits me. Okay, hits me at without I notice. Okay, so it's like actually where I would say that the mid of 2016, okay, I start to notice there's some I would say blood in my stools. Okay, then at the point of time, I was thinking that maybe it's something that's not really very serious in a way. Then I'll just continue my daily, because I have no symptoms at all, nothing other than the blood in the stool. So it's like I will just continue my daily lifestyle, my training, my work, all this. So it just continue. That was a mid of 2016, about maybe I would say May in 2016. Okay, so things just as usual. I didn't lose weight. I still pretty fit. I still can lift weights, everything. So months after months, okay, then until September 2016. Yeah. Okay. So it happens at this point. Maybe the first picture we'll be able to see. We actually went for a staycation, family staycation. Okay, so I have 2 kids, so that time they are still very young. So actually, yeah, we went for a staycation. It's like a very happy staycation. Everybody was so happy. So then we were just enjoying the staycation at Sentosa. Then after which something happened. Okay, so it's that I was in the restroom. Then after that, I finished using the restroom. Then my wife, she came and talked to me. She said, notice something is not right. Then I said, what is it? Then she said, it looks like you have blood in your stool. Then for me, it was like, maybe I think I'm not really concerned at the point of time. I'm so fit, I'm so healthy, should be nothing. But behind me, the time I was like, there's some thoughts comes in. So then after that staycation, my wife told me that maybe you should go and do some checkup. Okay, the time I was only 39 years old. I was only 39 years old. So then after that, when we finished the staycation, the following day after staycation, I went to the polyclinic to check up. Then they did a stool test, and after which we wait for the result for another week. Then after that, then they will say that, after a week later, I received a call. They told me that yep, we found blood in your stool. So they would like to ask, they give me a referral letter to go for my further checkup. And at the point of time, I start to have a bit of worry because I'm a healthy guy, and then why suddenly such thing happened? So then the referral letter actually was like for 3 months later, but something in my heart is telling me maybe I should try to call and then try to see whether able to shift it earlier, but somehow they said that it's full. Then okay, then and another way for me to speed up the process is actually I walk in to A&E. That is in September. Okay, end of September, very fast. Everything happens just within that 1 month time. Yeah. Then after that, went for the checkup, and I went for a scope, and they found out that there's a tumor in my large intestine. Okay, so that was totally, I was shocked, and I don't know what to do. It's like when then just after that, then explanation, and then said maybe the next step is that you might need to go for your surgery. You need to go for a surgery, not you might. You need to go for a surgery, okay, to remove it. And then well, for me, it's that if I have something wrong, I want to fix it. And then the next step is actually we went for the surgery in October. Yeah, pretty fast, within a month time. So I went for the surgery. Then okay, so I have a first surgery, which is the removal. That is actually they call it that first surgery, right? They actually is a keyhole surgery, but somehow, okay, the keyhole surgery, after that there's some complication. Okay, so that time the first surgery, actually I do not have any stomach. Okay, because they said, okay, you're using keyhole, so and then you can see from the picture, I actually at that point of time, from a very fit guy to actually learning step by step of actually how to breathe using the equipment over there. Breathing wise, I will hold on to my dominance, okay, during the part. So then after that, the surgery over, because we then realized there's a complication then that is another time that the second surgery is the part, okay, that they actually, it's a major surgery actually. Actually, there's some complication in the, I would say, inside. So they actually they did a second surgery in November 2016 November. Okay, then after that surgery is the part that actually they decided to create a stoma. Yeah, so that's me with my kids, all this. So actually that surgery yeah, is where I start to have ileostomy. Okay, yeah, as a temporary 6 months. They said temporary 6 months. So then yep, it's a stage 3 colorectal cancer at the time. Yep. Then after that I need to have the stoma. Okay, and well so after I discharge, okay, I have to learn, yep, to with the stoma, which is you can see from the pictures. Okay, so this is the part. Okay, this that is moving towards 2017. Okay, because after 2016 finished, moving to 2017. Okay, that is the year I would say is I'm actually my overall after having a stoma and after 2 surgery, I actually lost a lot of weight. I lost my muscle mass, I lost my stamina, everything. So but with a lot of help from the nurses in CGH at the time, okay, then and advice, okay, so I actually slowly built back, okay, and actually in 2017 I need to go through 8 cycles of chemotherapy. Okay, so when you're doing a chemotherapy, you actually there's a, I would say, the roller coaster. So 6 months of chemotherapy, 8 cycle. So every 2 weeks, then rest 1 week. Every 2 weeks, rest 1 week. Then sometimes we need to rest a bit longer. Then after that, continue. So at that phase, okay, because I'm a personal trainer, so actually I used to train people and train myself. But at that point, I am my own trainer, and also my wife. She's the one who consistently beside me. Okay, so actually we actually literally during that phase with stoma back, actually I start resume back. Even during chemotherapy, I resume back my workout. Okay, but I'm using my fitness knowledge in a way. I actually change my workout. Okay, I focus more on we call it a close change workout, which is a workout that is more seated. This is the later part already. Yeah, so actually, yeah, this is the building part. So actually I slowly build up bit by bit, okay, wearing belts, all this, and then rebuild myself step by step by step. Okay, so I started from walking to build on my stamina. Then I start to actually lift weights, and slowly, well, the center picture, that one is after I already done my reversal. Okay, then I rebuild it, because after I done my reversal, actually there was a period of time I can't do any sit-up. I mean, totally can't do any sit-up. I even have issue of getting up from bed after I do my reversal in mid 2017. But step by step, okay, keep yourself active is very important, and then seek advice from people. Okay, then after that, do it part by part, slowly, steady. Okay, then eventually slowly build up. I build up my strength, I build up my stamina, and actually eventually yeah, that's me now. Okay, so actually I was featured in 20, I think it's 2019. Yeah, 2019 is in a Straits Time. Okay, so actually seriously I'm very grateful that have this second chance, and then to keep fit, I would say, really. Okay, so it's actually about the positive mindset. Even with a stoma, I hit the gym. The time I hit the gym like 2 to 3 times a week. Okay, and then I will go for my walk regularly. Okay, and to keep myself, because actually the more you head out, okay, it clears your mind. Okay, and it's not, you won't be like hindered by what you have. Okay, you do it slowly and step by step. Okay, that's how it progress. Okay, so then always speak to someone, especially the time I always seek advice from my stoma nurses or friends like Ilya. So the time is like we'll always ask some advice from them. Yeah, so basically I would say that we need to focus is have a positive mind and stay active as much as possible. Okay, so when you talk about lifting weights or this, I would say you have to do it progressively, slowly. I'm someone who can lift very heavy weights, okay, but when at the point of time I actually lost my, I was at from about say 78 kg, then I lost my weight until about 60, I lost about 10 kg, okay, then 68 kg, when after all my ops, then I actually literally just holding 3 kg dumbbell when I started, holding a 3 kg dumbbell, and I started resume my workout, and it's just step by step. Okay, then 1 week, 2 weeks, 3 weeks, and when during my chemotherapy, the time actually there'll be some moment that actually I would say the downtime. Then actually when downtime, I just let my body rest, just rest, and then so after the downtime over, then I resume back again, try to go for my walk. Like my walk is usually the time I started from like maybe a 20 minutes walk, then 30 minutes walk, then 45 minutes walk, or even up to an hour of walk. Okay, so with stoma, actually at that time I using a belt, okay, and then actually for me is I wearing extra layer of clothes, okay, so I wear actually compression clothes inside, so to compress it, so when I do all my exercise, my stoma bag will not be like shifting, because mine is having mine is elastomy, so as what I mentioned, sometimes the only concern is always the leak, so it's always make sure that and then during the gym when I work out the time, I will just go to the restroom to clear the bag. After that, then resume my workout again. So same for when I head out for the walk, I will usually just make sure that the park that I walk, there's always a restroom and always able to drain it. Yeah. So yeah, it's all about staying active and keep yourself fit. Okay. So if always seek advice from someone. Yeah. So yeah, that's a quick sharing about my little journey. Okay, so I'm back to all my lifting now. Okay, but always I would say do it safely. Yeah, make sure you work within your range and pace yourself. Okay, yep, that's all I can share. Okay, thank you. Okay.
Hi. Okay, thanks. Okay, thanks, Sean, for the wonderful sharing. I believe that we have learned a lot from him as well. Yeah, thank you for sharing. Okay, so we will now proceed to the panel discussion of all the speaker. So any like audience from the floor or any question you can ask one of us, either Sean, me, JJ, or even Ilyu, about any question you all have about lifestyle, about leakage. Yeah. So any question, please feel free to discuss this panel discussion. After that, we will have some quizzes at the end of it.
Right. Yeah. So as Iris has said, you can ask your questions in the Q&A section. If you look at the bottom of your screen, there will be an option for Q&A. Just click on it and you can type your question there. And maybe to start off, can I invite Iris to answer one of the questions which has been raised already? And this is from Chief, and he said, doesn't too much physical activity actually cause peristomal hernia?
Okay. So for physical activity, it has to depend on what kind of physical activity. Okay, so usually we'll advise patient to we'll ask patient, are they into like contact sports? Contact sport like is as in like rugby, soccer, football, where you need, or basketball, where you need a lot of contact, because our stoma has got no nerve. So if you have contact sports, like example, the boots of the soccer boots, kick the stoma, you might not have any feeling that there's no nerve. So you don't want, like, patient or estimate to injure their stoma. So like what as Sean has shared, when he carry weights, right, he wear a support binder. Yeah, and then he wear those like attire that is fit for those exercise. So he's a professional, so he know how to control, like, how much weight to take. So you may want, if you want to do like weightlifting, you may want to consult maybe your stoma nurse, or you may want to consult a physical trainer on tips and how to manage. Yeah, if not, it will cause like prolapse and hernia. And then sometimes hernia is caused by weak muscle as well. Yeah, 20% of the patient who have stoma surgery may have parastoma hernia. Yeah, so I hope this answer the question.
So there's another question, maybe this one can direct to JJ. This is from Jessie, and she's asking, if it is a bit itchy, does that indicate leakage?
I would say that the itch is a symptom that warrants you to do an assessment to see. I would not say directly, oh, because it's itchy is because of the leakage. It could be like what I pointed out earlier on, fungal infection. And fungal infection does not mean that there's a leakage. It could be further away from the stoma or the contact area, but the fungal infection can also affect underneath the appliance bag. So the area that is very moist also. So just have a look at the skin, the condition first. Where is the leak, the itch actually coming from? And of course, if it's leaking, it can indirectly be a sign that it's, sorry, if it's itchy, it can be indirectly a sign that it's leaking. Yeah, I hope that answers.
Thanks, JJ. So while we are waiting for some more questions to be popped up, right? Maybe I can ask Sean, right? For weightlifting, for people with people with stomas, what are the precautions they should take, if they want to go to the gym to work out?
Okay, basically, if you want to start off weightlifting, right, I will advise you, actually, don't do it alone. Actually, we'll try to is to get someone who is experienced to guide you through, and then don't do all the weights that's super heavy. It all started from a lightweight, and then but every time when you do workout, even till now, even when I conduct my session trainings or this, right, I always when we do our workout, we should not feel any pain on the, especially on, if let's say if there's stoma, you should always check any range of motion. When you do all the workout, you should not feel any pain or strain, especially on the stoma area. Okay, that's very important. And breathing wise, okay, so make sure you have a proper breathing and leave the weights that within your means. Okay, you don't suddenly just start off with like maybe 20 kg or 40 kg, 30 kg weights like this. It all started from a lightweight first to get a form correct. Okay, and then when you do all the workouts, just make sure that don't overstrain it. Okay, like for example, if you have a stomach, actually till now, okay, I don't really do a lot of sit-up, but I actually do other workout that actually strengthen my core. Okay, because when you start to get hernia, it's actually, that's what Irish just mentioned, it's a weak core muscle, okay, weak abdominal muscle. So actually I do other workout, okay, other workout that to strengthen my core. Okay, like squats. Actually, squat itself is actually we have a proper way of doing a squat. It's actually to strengthen your core. And then also I'm doing like planks, all this in a way, a modified version of planks, all this, just to make sure that I build up my core strength. Then that's where actually you can prevent I would say reduce the chances of having hernia or this. And then also precaution wise, wear a belt is very important. I mean getting a belt to make sure secure it. Don't overdo it. Don't over push your threshold. You have to understand that you have to do it step by step. A lot of time people, when they start to get injury, is that when they hit in, okay, then they see, oh, last time I can do this. Now actually, I want to do it more, or you see sometimes it's seeing other people doing. I want to push itself more. So you do need to do it step by step. I strongly believe, because I've been through this journey. Okay, I learned to start one step at a time, and then have a journal to progress your workout. Okay, to understand, okay, today what I've done. Okay, then slowly build up like this. Yeah, that's how you need to progress. Then actually it becomes a lifestyle in you. Yeah, to constantly train and get yourself actually stronger. And then each time as you start to progress it slowly, you will be able to live up. I mean, for me, for example, when I had my reversal already, I actually cannot run. I cannot even from sitting down to standing up, I do have issue because the wound is still there. Okay, I have a big cut on my stomach, and then the reversal of the stoma, the wound is still there. So actually for about close to 6 months, I do a lot of other exercise, okay, slowly in the way to build up my core strength step by step. Yeah, and then eventually, then when there was a time, okay, I tried to do some slightly heavier lifting. I don't feel any strain on it anymore, but it's just, then that's where I able to progress my strength, all this as I go along. Yeah.
Right. Thanks, Sean. Before, actually, we have some more questions for you, but before that, there's a follow-up question on the itch part. Normally, itchy is underneath the base plate. How to know whether it's leaked unless remove the base plate? But sometimes you just have to wait and see. Sometimes the itchiness goes away. So I think there's a real concern here about, what you do, what you should do if you feel the itch. What is the action that you should take? Either JJ or Iris would like to answer that.
Okay, I can answer this question. So usually itch, sometimes it may not caused by leakage. So I tell my patient, you feel like very itchy, maybe if you change your base plate or your pouching system in 7 days, maybe you want to reduce to 6 days or 5 days, take it out. It could be some rashes or sometimes fungal infection also. Yeah. So let's say if it's due to leakage, okay, so if let's say you wear for 6 days and then it always leak on the 6th day, so maybe I will suggest patient, when the moment you feel the itch, be it before day or 5 day, you can actually change your pouching system. And then a good way is to have a good wash of the, you can either use Easy Cleanse or you can either use water to just wash the peristoma skin. And then you assess what causes the leakage. Is it cut the base plate, the wafer too big? Or could it be maybe the stoma has shrunk, maybe a flat pouching system is no longer not suitable, maybe you need to change your convex system with belt. Yeah, so a lot of issue as to why there is itchiness or leakage. If it's due to leakage, maybe a stoma has shrunk in or become flattened after maybe 1 month after surgery. So I would suggest maybe you go back and see your stoma nurse, and then you can change, maybe they will change you to a convex pouching system with some like stoma powder and then some barrier spray, and we will use some accessory like rings or paste or sometimes strip paste. Yeah, so this may help also. And then not cutting the base plate too big as well, because cutting the base plate too big, the tendency of the leakage of ECs, especially ileostomy, is more liquid pasties too. It might leak into the skin and then cause all the broken skin and irritation. Yeah.
Thanks,
So
Iris.
answer the question.
Thank you, Iris. And maybe this question I can direct to JJ. I had hernia surgery recently and my stoma has retracted between 2 folds. I switched to convex base plate, but the output sometimes goes behind the base plate. How do I prevent the output from seeping under the base plate?
Okay, so definitely you should go get the your body profile assessed as well. Ask your stoma nurse, because yes, convex base plate can help, but to a certain extent, because there might be existing skin folds. I have some patients that when they lie down, the skin condition looks perfect, but when they actually sit, the skin folds actually is more obvious. So in such cases, there will be a need for more thorough assessment as to where exactly is the leakage, although you already put the convex base plate, because there might be still some creases or skin deeps that may need to be evened out first. And on top of that, you might also want to consider stoma belts also to add on to the convexity. Sometimes because the abdomen is a bit more flabby, so it moves about here and there. So even if you have the convex base plate, it may not entirely address the problem. Yeah.
Thanks, JJ. I've got a question addressed to Sean now. What are some simple exercises that you can recommend besides squats to build up one's core? Right, but before you answer that, I just want to add that I was actually training with Sean as my coach when I started my gym session, and I had full confidence because he has been through the journey and he knew what the problem was for people like us with compromised abdominal muscles. It was going really well until the pandemic struck, and then we stopped, and then I've been too lazy to get back. So yeah, so I think it's important to get a coach who can observe and see and check with you what are the problems you're having and what your goals are, and then design a safe program or a workout program for you under supervision, right? So Sean, just to repeat Patricia's question, what are some simple exercises that you can recommend besides squats to build up one's core? Thank you.
Okay, there's another exercise actually is very simple to build up the strong core is to build it up. Is lying down. Actually, if you can try it, actually anyone can do it at home. Lying down on your bed or on the floor, okay, and you actually bend both knees, okay, with both feet on the floor, and then we call that a hip bridge. Is doing the bridge, lifting up your hips, okay, by so when you lie down flat and then you just push your hips up. We call that hip bridge. So you are lifting up and then using your breathing to contract your core muscle. Okay, so that is you can start with standing both feet, and then you just lie down, lie flat, and then just lift up your hips. Then you try to learn how to contract your abdominals. Okay, you can start with maybe like a simple of 10 reps, one set, and then you feel, does it feel any particular strain, or it's manageable? So the person who do workout, you should understand that, oh, if I feel very strained, okay, then I might need to stop this exercise. But if you feel it's manageable, okay, you do it slowly. You start from 10 reps, 3 sets of 10 reps, okay, with control, not just lift up your hips and then drop down. And also then after that, you can start with, well, from both feet on the floor, it becomes one leg can start to straighten the leg, and then you're using one leg to lift up your hips. So that is one exercise that you can do it while lying down. We call that a hip bridge. Okay, another one, getting your core strength is like doing some rotational exercise. Okay, so it's like you can even just holding a water bottle, okay, standing up, and then just do all the turning, rotation, all this. Okay, so maybe you're just holding a water bottle and then you just rotate your body, okay, in control. So you are working on your torso. Okay, that's when you start to move, you start with holding a water bottle. Then after that, start to using resistance bands, all this. You can do it at home. And if you're in a gym, then there'll be a cable machine, all this for you to work on it. So it's about breathing. So make sure you breathe at the time, exhale and engage your core. So make sure that when you move at the time, you can feel the abdominal muscle. And most important thing is that you should not feel any very discomfort, pain. Okay, a little bit of muscle aching is pretty normal, but not extremely sharp pain on the particular area. Yeah, because I have 1, 2, 3, I have 3 cuts on my stomach actually. I used to have 6 packs, but now it's all cuts here and there. So actually now it's that for me, even workout now, I always still ensure my core is, I don't feel any I would say very severe pain. Okay, a little bit of muscle ache is pretty normal, but always remember, you understand your body, you try to, or if not, then yeah, take advice from trainers or this lah. But some, I mean,
Sure.
for me, because I experienced through, so I actually understand more in depth about that. I've been through the step of progressing up. So yeah, that's my advice lah.
There's a related question, John. Sorry to interrupt you. The related question also addressed to you. Can I ask what sort of belt you wear and where you can get it?
Actually, for me, I didn't get any I would say maybe special belt, just getting those compression. I think as a start that time, I wearing those compression belt, soft. I think in the pharmacy you're able to get it, that type of soft compression belt with Velcro one, just to compress it, just keep it there, so you're more focused on your core. But later part when I able to start from the soft compression belt Velcro types, then slowly I actually progress to when I able to start to lift slightly heavier weights at time. I go and get those weightlifting belt, yeah, to give more support or more of a awareness of my posture or this, yeah.
So I think just a word of advice to follow up on that question. Before you start any sort of exercise, please check with your doctor first to make sure that it's safe. And also initially support belts for stoma patients, right? For ostomies, I think you need to consult both your stoma nurse and because there are products available out there, stoma support belts for varying degrees of exercise. So the stoma nurse will let you know, depending on the activity that you plan to do, what kind of support you need, and they can also advise you on where you can get those belts. All right. If you have problems finding out where you can obtain the belts, you can always approach OAS. But maybe I would like to call upon Iris to just add on to this a bit about the type of belts and the kind of support.
For the support belt, right? Last time Coloplast, we used to have these like support belt, but now they are no longer producing. So usually for support belt, I'll get them to buy either online. Sometimes they can ship from Australia online for the better quality one, and then they have like those pantyhose. That means the pants type also have. Those like minor, like the thinner version. You can actually, some of the hospital pharmacy they sell those kind of, we advise the patient to buy it for hernia support. Yeah, not so thick one, maybe a thinner version. Yeah, some of the most of the restructured hospital they do sell. Or if not, you can always buy online. And some patients they prefer like those online with a hole, where you can put the stoma bag up also have, or you can wear those like pants kind for better support. So the thickness and the material is slightly different. So depending on what sport you are actually engaging in. So you may want to check with sometimes with your stoma nurse, or you can actually check with OAS also. Like they especially they have a lot of he ordered from overseas, like Australia. Yeah, some are very good quality. Because he do a lot of exercises, he's very active. You can also check with him to do some sharing on this belt. Yeah, it's good if you're engaging in like more part of like more active sport, like maybe tennis, badminton, like cycling or jogging. You might want to wear a support belt, as what Sean has mentioned. Yeah, to support your stoma, to prevent any complication like prolapse or hernia. Yeah.
Thanks, Iris. JJ, maybe you want to add to that?
Yeah, I think in Novena you can get one from the wide range of belt from the from Omegon. That the Sozo Clinic they actually have there. You can ask the clinic there for assistance on which type of belt to use and select. Yeah, I will also add on about the hernia management. I think some patients they also can get hernia from vigorous coughing. So we also need to teach them how to apply some kind of pressure. I think more so for the elderly that I've observed that they cough very vigorously, and I do see that the hernia starts to develop around the stoma. So then we have to teach them some techniques to push down when they cough, to exert some force as well. Yeah, so it's not just physical activity, but with if you strain too much, it can also cause a little bit of hernia. And at the recovery phase, when they did the surgery, that phase is especially important, because that's when your wound is still healing up. So that's when your weakness is more profound, and you're more vulnerable at developing hernia. Yeah, so subsequently, so I think a lot has been discussed that we have to do it progressively. Yeah. Thanks.
Yeah, thanks, JJ. So I also like to add that you can always, first of all, very important, you need to check your doctor first, right? After that, you also need to check your stoma nurse to see what are the necessary support equipment that you need, and then they will recommend to you. And then if you still have further queries, you can always reach us at OAS. We have a help email address, which is help@oas.org.sg. We'll put it in the chat group later. We also have a hotline that you can call. You can find the hotline on our website, which is www.oas.org.sg. We'll be more than happy to direct you to the right place for your needs. Right? Are there any more questions? There's none in the Q&A box. Otherwise, I'll hand the time to Iris and Warren to carry on with the rest of the program.
So now we are having quiz. Okay, so we will have 3 questions. So Warren will introduce about the quiz, the question, and how to win prizes.
Right. Thank you so much, panelists, moderators, and thank you to the participants for your questions. I believe all of you have learned something new today, and it will definitely help you in your stoma journey if you are in ostomate. Right. So now we are in our quiz section, and we have 3 questions that's going to be opened up to the floor. And we have prizes that you can see on the screen. Right. Very importantly is when we ask the questions and when you answer, the thing is the answer that you see, we only choose the first 3 answers that we see on our screen, right? Not your screen, because your screen will show your answer first. Right. So when we start, we will be choosing the first 3 answers that we see from our side. Okay, and at the end of the webinar, we will announce the 3 winners, and then we will contact you for your address via email. Okay. Right. We will start with the first question. Which one of these may cause leakage in a stoma? Right, we have 3 choices. A, skin folds, B, rashes, or C, a well-budded stoma. Right, please go to the chat box to type in the answer, and we will pick the first 3 answers that we see from our screen. Okay. Now we move on to question 2. Right, question 2. Which one of these is a stoma appliance that can help with leakage? Oh, I'm seeing a lot of answers coming in for all 3 questions. Please do not answer all 3 at the same time. We're going to go one question by one question. So please answer only question 1 for just now. And now we're moving on to question 2. Okay, for question 2, which one of these is a stoma appliance that can help with leakage? Right, so A, baby powder, B, screwdriver, C, strip paste or paste. Right, which one of these is a stoma appliance? Please answer in the chat box, and we'll pick the top 3 answers that we receive first. The 3 correct ones, of course. Okay, I'll give you 1 minute just to answer the questions, and we move on to the next and the last question. Right now for question 3 and also our last and final question that we have for our quiz section. Right, question 3, which one of the following is a urine diversion stoma? A, colostomy. B, urostomy. C, ileostomy. So which one of the following is a urine diversion stoma? A, colostomy, B, urostomy, or C, ileostomy? Right, please answer in the chat box, and as per the previous 2 questions, we will pick the first 3 correct answers that appears in our screen. Thank you.
Maybe just a note here. The answers are supposed to be in the chat box and not the Q&A. Because some of you have answered in the Q&A. Yeah, and I think Warren's instruction was in the chat box. All right, so just take note of that. Thanks.
All right, thank you for the participation in our quiz section. We will announce the winner at the end of our webinar. We will actually get in touch with you for your email address, and for the prizes that you won, we will be contacting you for it. Okay, next up, we actually have something that we wish to share with our patients. Our special promotion for the patients that have attended our OAS webinar or even our seminar before, you realize that we always have a special promotion. And for this time round, we are having a promotion of buying 2 boxes of C-shaped elastic tapes and get 1 can of Brava remover spray for free. Right, and how will you be able to enjoy this promotion? Please do call Coloplast Care Team at our hotline 6235-5933, and please do inform the customer service, quote this code that we are going to be offering, OAS-2021. Let the customer service know this code, and she will actually let you enjoy this special promotion. So if you don't know, or you don't present this code when you're ordering, you will not be able to enjoy this special promotion that we are giving to you this time around. Okay, so the offer is limited to 1 spray per redemption. Right, so you won't be able to buy 4 and get 2 free. So per redemption is only 1 spray. So 2 to get 1 can of remover spray for free, right? And our promotion will end on the 30th of April 2021. Right, for patients who are using the elastic tapes and also the remover spray, this is the best chance for you to take this opportunity and get a free spray for free. And for patients who have not heard of either products, it will be a good chance for you to try either one. You can contact our customer service and request for samples also before you choose to buy. Okay, now shall we have Mr. Ilil again for a closing speech? Mr. Ilil, the president of OAS, for our closing speech for today.
Yes, hi everyone. Thanks for staying on, and I hope you really had a good time with the quizzes. I think the questions raised were quite, what should I say, well thought out. It's basically education, right? Education on how to manage the condition. And OAS is all about managing conditions so that you can live an active and meaningful life, right? Life does not have to end just because you have a stoma. Yes, we are not like what we used to be before. Yes, we cannot do a lot of the other things that we did before, like playing rugby or boxing or contact sports like that, as Iris mentioned. But there's still so many things we can do, all right? And as we age, we need to remain active. We need to maintain our muscle mass. We need to eat well. right? And mental health is also important. And if you engage in sports activities, physical exercise, your mental health will also improve. So there have been many useful nuggets of information that have been presented by Iris, JJ, and Sean especially, as an ostomate having been through the condition. If you have any other queries at all, please feel free to reach out to us at OAS or to your stoma nurses. The main purpose of the Ostomy Association of Singapore is to help ostomates lead better life, have a higher quality of life, right? And we will try our best to assist in any way we can. But I would like to thank again Iris, JJ, and Sean for their inspiring sharing, and also for Coloplast for organizing this education series for the benefit of ostomates and our members. Right, back to Warren.
All right, thank you, Mr. Iliu, for the closing speech. And with me, I have the winners to our quiz section just now. Right, for every question, we have 3 winners. I will read out the names. Of course, you can also go down to our chat box to check if you have won. Okay, for question 1, the first 3 answers that we have received correctly comes from Jessie Ng. Hopefully you're still around. Wei Qi, and also Lim Jing Yi. Right, winners, please do come into the chat box and leave your contact details with us so that we are able to contact you.
An email, the email address that we put into the SG Care one. Just tell them the email.
Right, just drop us an email so that we'll be able to get back to you.
SG Care. Yeah. Email.
Right, and for question number 2. Question number 2, the first 3 answers, the first 3 correct answers that we have received comes from Lydia Tong, Kathy Lim, and Lim Roger. Right, you can choose to leave your email here in the chat box, or you can actually email us at our SG Care email. Either one is it works for us. Right, and for question number 3, the first 3 answers that are correct that came in comes from Theo Key, Sheep, and Ray. Congratulations to all 9 of you winners. Please do leave us your contact details here, or please do email us from our SG Care email. If you do not leave us your details, we will not be able to contact you or to send you your prizes. Right? Congratulations again. Thank you so much. And we have actually come to the end of our webinar today, right? And we hope that this session is a fruitful one for you. Learn something today. And if you have any questions, actually the questions are addressed. I'd like to thank OAS for collaborating with us once again. For the participants today, if you need to know, we actually does this webinar twice a year. In the past, we actually hold it physically, but due to the current situation of the COVID, yeah, so we are not able to do it physically. We are only able to do it digitally. We hope to see you again next time. Hopefully by that time, we'll be able to have gatherings of more people and we can actually hold an event physically again and be able to really see you guys in person and be able to answer your questions and help you with whatever issues that you are facing with your stoma. Right, thank you for your attendance. and your attention in this span of 2 hours. And we really hope to hear from you and see you. Thank you to Jin Jie, thank you Sean, and thank you Yuklin for staying with us in the being a moderator for this entire event. If you have any questions, please do contact us, or you can contact OAS if you feel more comfortable. Right. Thank you so much. I shall leave. I shall leave the chat room open to those who are still going to leave us your contact details. And thank you all so much. Bye bye.
Right. Just to remind you all that when you exit the webinar, you'll be redirected to a survey. Just help us improve what we are doing by responding to the survey. Thanks. And have a great weekend, everyone.
Have a great weekend, everybody. Bye bye.